This talk is about why hand surgeons should use alcoholic chlorhexidine gluconate skin prep. It's a very important topic because around the world, 10 million people undergo clean operations every year, and infection is the most common and costly complication. Whilst numerous bodies and guidelines do advocate chlorhexidine gluconate skin prep, there's a gap in the evidence with regards to clean surgery. That's the majority of hand surgery. And this is principally due to the limitations of conventional pairwise meta-analysis, where you bundle up disparate treatments in order to compare them. This can be perfectly resolved by network meta-analysis, and it's why we've readdressed the topic. Our systematic review found 17 studies of nearly 15,000 patients who underwent clean surgeries. The primary outcome was infection. This is the network plot, which shows that the majority of patients were exposed to alcoholic chlorhexidine gluconate, 2 to 3%. A sizable minority were cleaned with povidone-iodine, whether in water or alcoholic solvents, whilst the remainder received chlorhexidine gluconate of other concentrations in alcohol. We present the results of our network meta-analysis in a league table. This shows all the possible combinations. The best treatment is in the top left, the worst is in the bottom right. For now, ignore the top triangle and zone in on this particular comparison: aqueous povidone-iodine versus alcoholic chlorhexidine gluconate. If hand surgeons switched from aqueous povidone-iodine to alcoholic chlorhexidine gluconate, then the risk of infection on average in their patients would be halved. At very best, the risk reduction may be very much more substantial, or in the worst case scenario, alcoholic chlorhexidine gluconate may be no different to povidone-iodine. This is a very important reduction because it appears to be for free, because we observed no ignition fires. There were no reported burns, either from pooling or under tourniquets. And the only events of contact dermatitis were reported in patients exposed to povidone-iodine. This is very important information for hand surgeons because you do more than 200,000 operations every year. Come what may, about 3% of your patients will get an infection. And every infection costs the NHS more than £385 per person. So by switching from povidone-iodine to alcoholic chlorhexidine gluconate, we could prevent more than 3,000 infections every year and save the NHS more than £1.2 million. Thanks so much for listening.